From KUNC and the NPR network, this is In the NOCO. I'm Erin O'Toole. Many of us look forward to summer all year long. Sitting by the pool, reading your favorite book. Cooking everything on the grill every single night. Cold watermelon, icy popsicles. But then summer gets here, and the alerts start coming. Ozone Action Day alerts, air quality alerts, heat advisories. You might be getting lots of push notifications these days. So far this summer, we've seen more than 25 days with highs over 90 degrees. And federal air quality regulators say Front Range cities have racked up multiple ozone violations this year, according to the Colorado Sun. So when you get alerts about heat or air quality, you may wonder, what do I really need to pay attention to? Today, we're going to talk through what these alerts mean and how and when you should change your plans. I'm joined by Lisa Romero, a lead community health consultant who specializes in the health effects of poor air quality. Lisa, welcome to In the NOCO.
Thank you for having me.
Lisa, I want to talk a little bit about your background. You used to work in Commerce City, which has some of the most compromised air in the Denver metro area. How did that experience affect your path toward working in public health and air quality?
My background is clinical, so I'm a physician assistant by training, and I started my career in Commerce City, and that's really through my experience taking care of patients and families and seeing the challenges that they faced trying to get healthy or stay healthy when they didn't have clean air to breathe or they were living in a really polluted environment was really a source of inspiration for me wanting to work upstream of the exam room, so to speak. So I practiced clinically for a number of years, but I knew that I wanted to pursue more public health training in this area. And that's really where I started to witness firsthand the impact of living in a really polluted area and how that impacted my patients' health and their families and just the difficulties it presented to try to get healthy and stay healthy.
Well, let's talk about ozone alerts because we certainly see a lot of those popping up this time of year. What symptoms might I see during an ozone alert?
So ozone is really an irritant to our lungs is the most primary symptom that we think of. And so when you breathe that in, like I said, it really causes irritation and inflammation in the airways. And so you may notice things like shortness of breath or a sensation of wheezing. And certainly anybody with asthma or COPD or underlying lung disease is going to notice that more as well.
So ozone definitely can affect my lungs and how they feel. What about the rest of my body?
Ozone, again, it causes a lot of inflammation kind of in and maybe right around the lungs. Other air pollutants we know can really travel even further. So something called fine particulate matter or the really small air pollutants, particles can even cross into the bloodstream and spread to other tissues around the body.
So as a former physician's assistant, what do you do, Lisa, when you get an ozone alert in the morning?
Going back to the point that this is something we should all pay attention to, it's really about awareness of the conditions we're experiencing and awareness of our risk factors. So for me, I like to run outside, I like to hike. So if it's an action alert day, I may choose to move my exercise indoors, or I may try to really make sure that I'm getting outside early in the morning before that ozone alert kicks in, just to make sure that I'm not putting myself at risk for those health impacts.
Wildfire smoke, of course, is another type of alert we'll see in the summer months. What can wildfire smoke do to the body?
I should start by saying I'm not an air pollution or air quality expert per se, but from a kind of population health, community health perspective, we know that the air pollution from forest fires has a lot of different types of pollutants in it, but one of the ones that we know really impacts health is something we call fine particulate matter. So that's the really fine, small particles that come from forest fire smoke, among other sources. And what's important to know about those particles is we, of course, breathe them into our lungs, but they're small enough to actually get even into the bloodstream. And from there, they can impact other systems in the body that we might not think about when we're thinking about the risks of smoke exposure.
I often see information about fine particulate levels when the air is smoky from a wildfire. What does that do to the body?
A lot of times when we can see or smell smoke, when we think about breathing it in, we think about how it might impact our lungs. But what's important to know about, especially that fine particulate matter, which are the really, really small air pollution particles, is they can cross into the bloodstream. And from there, they can actually impact other parts of our bodies that we might not think about. So it can impact our heart and the blood vessels around our heart. It can get into other tissues as well. And so it goes beyond just lung impacts.
So who are the groups that are most at risk when we get these poor air quality alerts?
We know that adults that are over 65, children, outdoor workers, pregnant people, and folks with, again, underlying health conditions are at higher risk. But low income communities and folks living in historically marginalized communities are also at greater risk.
And is that a factor of just more air pollution? Why is that?
We know that low-income communities and historically marginalized communities are often located closer to sources of pollution. So they're often closer to major highways. Oftentimes they're closer to industrial facilities. And the built environment around them is also often a factor in creating more heat and air pollution as well. So those neighborhoods may have less tree canopy, less vegetation or green space that can help keep the area cool and keep the air a bit cleaner. But it's also a matter of sort of compounding risk factors. So we know in these neighborhoods, they also have a higher social burden when it comes to health factors like safe and secure housing, access to adequate nutrition, and access to healthcare as well. So it really is a compounding of factors.
You mentioned young children on that list of people who are most at risk, and that surprised me a little bit. I would assume young children might be more resilient. Why are they part of this risk group?
Right. Great question. And this is why it's so important that we talk about these things, because I'm also a parent and I might not have known this either. And it thought to be in part because they are still developing, especially the very young children, their system is still developing. And they have smaller bodies, but they breathe more frequently than adults do. So it becomes essentially a dose issue. So they're breathing in more frequently relative to the size of their body. So they're at risk from that standpoint.
Well, Lisa, as I mentioned earlier, it feels like we get so many alerts on our phone these days. They run the risk of becoming just background noise. Sure. Do you think we get too many alerts, and is that a problem?
I don't know that I can answer whether we get too many or not enough or just right, but I'll share what I think about when it comes to these alerts. And again, I know that air quality is so important for us to all pay attention to, but what I hope when I see these alerts is that they're reaching the people that are most at risk. And I hope we understand if they are reaching some of those older adults who maybe aren't as comfortable with a smartphone, or if they're reaching people who speak another language or don't have access to the technologies that are alerting those of us that do have access.
Well, Lisa Romero, thank you so much for talking with me today about this.
Thanks, Erin. It was so great to be here.
Lisa Romero is a community health consultant with Kaiser Permanente. And that's it for us today. I'm Erin O'Toole. Thanks for listening.